I am Jane Neubauer, and I work with the Early Childhood Dental Network out of West Central Minnesota. And we're just going to share a little bit with you today about who we are, kind of what we do, and why we do this. The most important things you're going to hear are going to come from our panelists here today. These are folks who have worked all throughout rural Minnesota, started some really great initiatives, and they're going to share with you how they've been able to do that and accomplish that. But first, we're going to start off with kind of a painful video for me because I'm in it, but other than that, it'll tell you a little bit more about who we are. So.
The Early Childhood Dental Network was started in 2005 as a project of West Central Initiative. The issue of early childhood oral health was brought to the forefront through the Early Childhood Initiatives, which are located in the 9-county region and in the White Earth Nation. Each of the Early Childhood Initiative programs did a survey and assessed what the needs were within their respective communities. What emerged from each of those counties' surveys was the need for increased oral health care and access for young children.
Opportunity that outreach clinics provide to children is that it eliminates some of the transportation issues of getting directly to the clinic. So we come to the schools and the children are able to come right from their classrooms down to the clinic and have their work done. Parents are invited to come also if they need to. A lot of the children here aren't able to get access to a dentist's office. They're given the opportunity to have early dental care where we can do some diet counseling and prevention methods and education with the parents and the children all at the same time.
Dental access is a priority area for the Early Childhood Dental Network. With partners like Caring Hands Dental, Apple Tree Dental, and Children's Dental Services, we're able to provide dental outreach clinics throughout the region in rural areas of Minnesota where otherwise children and families would not have access to dental care. We have dental outreach clinics strategically located throughout the region, which provide that dental access to those families right in their home communities.
The ECDN has just done such wonderful work since it's been going, just gathering people that serve kids and families and provide those services, and figuring it out how we manage to provide things close to where families are, because we know what families were doing before was maybe having to drive an hour and a half, 2.5 hours to find a dentist. So these outreach clinics that happen right in their local communities with staff that is just trained to meet the needs of kids and families, it works just great.
West Central Initiative routinely gathers these folks at the table to discuss what the current issues are and how to better address those needs.
The big issue that's out there for the problem with access is the funding. I think the root of the funding, or lack thereof I should say, of funding is because dental has always been put on the sideline. They've never combined medical and dental together, even though they are very important to each other. We have a lot of patients come in that have to have their oral health fixed up before they can have some medical work done. So it is starting to be more noticeable. Less than 3% of the Health and Human Service budget is spent on dental care.
I believe that there is a lack of dental providers. I believe that there is lack of funding, that dental insurance covers. Why do we even have to have separate dental insurance? To me, that's a medical issue.
They have worked consistently for the past 8 years to put together projects, programs, services, and informational materials which would help promote early childhood oral health in our region.
The other thing that's happened is the education factor over the years. It's been taken out of the schools and other areas where they're not learning about it throughout their whole childhood. We do very well through the Early Childhood Dental Network. The 1 to 5-year-olds, we really key on them hard through Head Start and other means. But once they get to the 6th year and above, the education factor tends to be forgotten. And when they become adults, they don't remember what we told them in Head Start. So it's an education issue besides just the funding.
Education and awareness are a priority area for the Early Childhood Dental Network. We believe that by working together with our early childhood professionals and with parents and children, that we can make a difference for early childhood oral health in West Central Minnesota. The Early Childhood Dental Network is coordinated by West Central Initiative and made possible thanks to our sponsors. Learn more about the Early Childhood Dental Network at ecdn.wcif.org. The Early Childhood
So that's just a little bit about kind of where we started in West Central Minnesota. And what isn't on the video is part of why we're doing what we're doing. And for just another minute, I'm going to have her play a video that you did see a brief clip there with a parent of a child in our region who agreed to be interviewed on camera for us. And I really like to share a little piece of that with you because I think it brings home for all of us why we're doing what we're doing from that family's perspective. You know, we're a whole lot of professionals sitting here in a room working on an issue without a lot of input from our families and those folks that need us the most. And a lot of that is because they're not real comfortable being here in this room with us. And we all work really hard to make sure that's not the case, but the reality of it is it's happening. So I'm just gonna have you play that for a minute.
I'm married and I have 3 kids, or we have 3 kids, and the oldest 2 have been part of our local Head Start program, and they have had an outreach dental program that has come into the school. Let's see, last fall, 2015, my middle child went, and we got a letter stating that they had found some concerns and would refer him to a pediatric dentist. We were told about a pediatric dentist out of the St. Cloud area, and in calling and trying to make an appointment, they were only here in Alec for a couple of times a month. With the holidays, those times were supposedly booked already and or not available because, like I said, the holidays, that their time in Alec was less than their normal occasions during the month. We were not able to get him in until a scheduled appointment for February. So this is the beginning of November till February that we were even able to get him in. When we were able to get him, or we were then put on a waiting list. And I believe it was the 7th of January, just the day or 2 prior to that, we got a call saying they could get him in right away in the morning. And this was in a different pediatric dentist, also based out of St. Cloud, but coming out, in one of the neighboring communities. Before I left, I had an itemized bill. When I say when I left, it means me and my son, who had been there now for x-rays and a hygienist appointment. They didn't complete the hygienist appointment, even though he was very cooperative. He was happy to be there. But like I said, I came up with an itemized bill of between $5,000 and $6,000. They were not going to start the work until we had a way of paying it. Okay? The hygienist wasn't going to do the cleaning or anything of his teeth because the recommendation was that he be put under for this dental work. The cost estimate, over half of it was due to the use of the surgical facility that he would need to be put out in, and the cost of the anesthetist or anesthesiologist and the nurse anesthetist. And they felt that at that time is when they would do his cleaning. My husband and I don't have that kind of cash in our checkbook savings. Dental insurance covered maybe $1,200 of it. And we were at a loss as to where we're going to come up with the rest of it. The other part of the story is that the same son of mine was recently, just prior to that, referred for an IUP for speech issues for not being able to pronunciate his words and stuttering. I called for second opinions. I got a couple of them, and they were to pull his teeth, the ones that were having issue because they were baby teeth. I couldn't justify pulling his teeth when he was just referred for an IUP.
And so I think that really brings it back to all of us why we do the work that we do. We have thanked this woman numerous times for being brave enough to share her story. And what she's going to go on to tell you, or she would go on to tell you in the story, is that what they determined was that the IEP and the speech challenges that her son had actually related back to the oral health problems that her child had. And so all of those dollars, all of those things that were invested into that family could have been resolved if those oral health problems had been addressed earlier. So anyway, I know I'm preaching to the choir here, and I would like to introduce all of our folks here today. These are the folks that have really helped to make the ECDN work happen across the state of Minnesota. I also can't go on without recognizing the Otto Bremer Foundation. They approached us in West Central Initiative going on 5 years ago. Has it been 4 years? 4 years, okay. And asked us if we would be willing to replicate what we were doing in West Central Minnesota and other parts of the state. And so our West Central Initiative reached out to the other Minnesota Initiative foundations and asked them if they would be interested in getting involved with that. And so that is who we kind of have here today. Connie Bye is going to kind of share. She has been with us since the beginning of time with Early Childhood Dental Network and is representing Head Start. And I like to recognize Head Start in all of this because they too have been a really key player at the table for us with getting our Early Childhood Dental Network stuff going. So with that, I'm going to turn it over. I think we have a microphone. And so Don Hickman is with the Initiative Foundation based out of Little Falls, Minnesota. And they have some kind of pre-questions that we have. And so Don, I'll just turn it over and let you talk.
Very good. Testing? All right. If I am going on too long, give me the look. Okay. So one thing Jane didn't spell out, and I'm guessing most of you don't know this, is that there are 6 initiative foundations serving all of greater Minnesota. We were born in the mid-'80s as a response to the farm crisis, and all of us committed to economic and to community and economic development in rural areas. We give grants, roughly $2 million a year each, and lend as a charitable activity. And all 6 of the initiative foundations have been committed to early childhood issues since 2004, but that's primarily been focused on literacy, school readiness, and social emotional adjustment. We've known of West Central's focus on dental since they started it with great envy. And the reality is they had one extraordinarily generous donor that got them started. And we were not in the same situation. But about 5 years ago, my friend Lou Herr at the Otto Bremer Foundation came to me and explained that I would be asking him for money and I would be following Jane's lead. And when Lou says jump, I ask how high. We had a slightly different frame than what West Central had done. West Central's focus had been basically helping kids for whom distance to a provider and or poverty was the barrier to dental access. And we added to that language or culture. My region's historically been one of the most homogeneous in Minnesota, and that is no longer true. In the last decade, we've gained over 10,000 East Africans just in Greater St. Cloud, a significant contribution from the Latino community as well as smaller populations that are equally diverse. And of course, we are the original inhabitants of the region are Native American and still have all the same issues as other rural communities with high rates of poverty. In our first year, should I hold this for later? Is that enough introduction? Should I keep going? Go? In our first year, we did a bunch of demonstration projects. I look back at it and only partially in humor say we made a lot of mistakes. I'm pleased to hear that both Sarah and Deb are here. They've been critical partners in bringing mobile clinics to our region. And all the mistakes were my own, not theirs. But things as basic as they assumed we'd have Wi-Fi where we were meeting never occurred to us that we'd need it. The first time we hosted the African Women's Alliance, it was in the basement of a church, and frankly, that wasn't the most welcoming place to many of the new Somali families. On and on. And so we were very humble and tried to learn from those mistakes, and people were very gracious because just like I hope all of you are getting as choked up as I was at that video, when you realize everybody's there to help people in need, you just keep doing it till it works out. 3 evolutions that I'd like to call out. One, based on that last learning opportunity that I confessed to, is we realized that the dental professional population in my region was 100% Caucasian. And that in itself was a bit of a barrier. And so dear Lou Herr stepped up again and gave us $200,000 to recruit, retain, graduate, and place students from diverse populations. Working with St. Cloud Technical and Community College and Central Lakes College in Brainerd, Minnesota, we've targeted Mille Lacs Band of Ojibwe, East African, Latino, and now even a couple Cambodians I learned yesterday, to enter the program, and by next fall we'll have 20 graduates with either 1 or 2 year degrees. But I feel like that's one of the best projects I've been involved in. We also realized that for as meaningful as these 1 or 2 day mobile clinics were, we are kind of scratching the surface and kind of applying a Band-Aid to a really chronic problem. So our program director at the time suggested we focus on one county. Mille Lacs County was chosen, and I know Christine Kopp is here, and Christine, you are my hero. She does amazing things and stretches a dollar around the block. Mille Lacs has a high rate of poverty, and of course is the home to the Mille Lacs Band of Ojibwe, but many other children in poverty as well that are not tribal members. And Christine has coordinated all kinds of outreach to Head Start to make sure that screenings and mitigation are occurring. I know that's the law, but it doesn't mean it happens without a little support and attention to it. She's coordinated multiple mobile clinics, and the part that I am so grateful to her for, because money is always going to be a limiting factor, is she has what I call a navigator or ambassador to medical assistance. And so when a family comes in and they are qualified but haven't previously been approved, she'll get them the paperwork filed on spot. She'll stretch the dollars that much farther, knowing that we'll get reimbursed, and then be able to treat that many more families. My big headache with her, she keeps calling up and saying, I need a little more time because I haven't spent all the money yet. We can serve more people for this grant. And I wish all grantees had that problem. I'm going to hit one more question, then I'll pass it on. We were asked what's the number one thing we do to make it different. And this isn't going to be news to you, but we have decided to take the leap that's not a very comfortable one for us to intentional advocacy. Clearly, until we reform reimbursement rates for medical reimbursement to dentists, they are losing money every time they treat a patient with MA, and anything else we do is a temporary fix. And I believe that if the dentists see that we are on their side, that if I've got public health directors like Christine and mostly moms who are as moving as that one, marching on the Capitol, not with their fists in the air, but just saying we need help. This is a core issue. Kids cannot succeed in school and will not be productive in the workforce unless we catch this early. That I'm quite confident it'll be a purple, not a partisan issue.
Good afternoon, everyone. My name's Teri Steckelberg. I work for another one of the initiative foundations, the Southern Minnesota Initiative Foundation. Our office is based in Owatonna, and we cover the 20 counties in southeastern Minnesota. So many of you are familiar with the larger communities of Rochester, Mankato, but we also cover all of those small rural communities in the area as well, with around 176 different communities in our region. We were approached by the Otto Bremer Foundation and West Central Initiative back in 2015. So 2 years ago, after Don's foundation had undertaken the Early Childhood Dental Network work and asked as well to expand to our region. And not knowing a lot about oral health myself, but having learned a lot about early childhood and what the needs are over the last 11 years at the foundation. With some discussion, we decided that we would undertake it. It's hard to turn away money that is freely given out to you to do great work. And so we use a little bit of a different model in our region. We have 25 early childhood initiative communities, which all of the Minnesota Initiative Foundations have, and we decided to work through those networks that we had already established across our region and ask them to reach out into an area that none of them had decided to tackle yet, and that being oral health. So what we did was recruit coordinators in 5 of our counties, and those counties are Brown County, Rice County, Martin County, and then the Blue Earth and Nicollet County area, which Blue Earth Nicollet County covers the Mankato, North Mankato area, as well as many small communities. Martin County is the Fairmont area, very rural farming communities in that county as well, a whole lot of poverty there. Rice County covers the communities of Faribault as well as Northfield, which many of you are familiar with. And then Brown County is one of our most southwestern communities, like New Ulm, Sleepy Eye, some of those communities. So we tried to spread the work out across our region, but yet tapping in 5 counties where we had a lot of interest to participate and to serve the needs of oral health for children birth to 5. And so 2 of those counties, Brown and Rice County, were our first communities, and they started in 2015, and then Martin and Blue Earth Nicollet area started in 2016. So some of them have 2 years under their belt, some of them 1 year. Each of them has decided to focus on different areas of oral health. Some of them are addressing more around access, and some of them are addressing very heavily in the education piece of things, education for parents, for caregivers, for child care providers, for early childhood professionals. There is a lot of need to educate anyone and everyone around oral health and what are the best practices for kids birth to 5. So some examples in Rice County, they are actually tackling access. Rice County is very fortunate in that they have 2 rather large providers, Health Finders and Southern Heights Dental Group, which are 2 that service a lot of children who do not have access to dental care. People from across our region go to those 2 communities of Faribault and Northfield to access oral health services. And so they had less of a need around finding someone to provide that care, but yet to help those organizations to sustain their work. And so what that group has decided to do is offer a stipend to providers that are willing to see kids who are on MA or have no insurance at all. And so they set up a small program, because we don't have a ton of money, where they offer up to reimbursement for up to 5 children per month for those agencies to see kids that they normally have not seen before. And we offered that program out to all the dentists in the area in that county, private dentists as well as the nonprofits. And to date, we really have only had those 2 organizations, Health Finders and Southern Heights, participate. The reimbursement isn't a lot. It's $100 for preventative care for x-rays and cleaning and fluoride. So it doesn't cover all the costs, but it helps to supplement some of those expenses. So that is probably our biggest effort around access to care. Some of the other things that have happened, well, I guess in Martin County, we have recently piloted a partnership where we had a local nonprofit come into the school district and offer slots to kids, Head Start kids as well as school district kids. And that was kind of a unique partnership because we did get local private dentists to agree to see any of the children that had been served by that hygienist that day and needed follow-up care. So we did garner a little bit of support from the private dentistry community that normally would not see the more at-risk children. So that was a step in the right direction. We have been doing a lot of parent education, a lot of focus on educating providers. In Blue Earth and Nicollet County, we have been doing a lot of work with the Children's Museum of Southern Minnesota to develop a traveling dental education exhibit. And now we've just gotten the Mayo Clinic on board with that as well. And so we're looking to raise some funding to manufacture the exhibit and then work with a lot of agency partners to have that exhibit go around the several counties around the Mankato area and reach children and families in a whole variety of programs that are available for kids birth to 5. So we're excited about that partnership as well.
Hello, my name is Connie Bye, and those of you that know me know I could talk about this topic all day. Fortunately, I didn't hear about it till I got here today, so I didn't prepare a big long list. My background is in nursing, and I spent 29 years as a Head Start health coordinator in rural Minnesota, with about 85% of my time spent on oral health. I learned more about oral health than I thought I ever would. And prior to being on the initial committee for the West Central Initiative, I was working on a project, statewide project through the Minnesota Head Start Association to address oral health and access and education when dentists started limiting the number of medical assistants, patients that they saw, or not seeing any at all. And our rates of completion of Head Start children, and these are just the 3 to 5 year olds, seeing a dentist had dropped down to about 70%, and which is really alarming in the fact that children weren't able to even get into a dentist. Compounding that, in the 5-county area that we served at that time, there was not a pediatric dentist. And 2 of the centers that we served, you saw in that video today, the one where you saw the very similar looking twin dentists. They work at Caring Hands Dental, and where you saw the construction paper sign, that was an old school kitchen that adjoined our Head Start classroom, where we literally set up dental clinics twice a year. Also, as we work through the Head Start Association project, the collaborative practice came in, and we had one collaborative practice dental hygienist that got trained by Deb Jacoby and then helped train and calibrated hygienists across the state to come into Head Start classrooms. We were able to increase our completion rate to up to about 87% within a year of doing that. That particular hygienist's husband was also in this video, who is now managing the Caring Hands Dental Clinic and used to be a boat dealer. That's how passionate this family is. And so we were really fortunate to be in a position to have already been working on it, but to be able to come to the table with a group of people with similar interests that maybe weren't as driven by compliance as Head Start is, but still had the passion for children to be able to incorporate good oral health into their overall health. And by working within the initiative, we were able to get some funding and get on the list to bring mobile dental services to our classrooms. the thing that happened, even though they weren't able to get treatment, they didn't have the equipment like Children's Dental Services had, is they made good patients once they did get into a dentist. And that was Al that you saw in the video is like, man, if every child that came through our door could be seen in school first, where they know they're safe, they have a good experience, our job would be so much easier and we could see a lot more patients. So we're struggling with 100% compliance, which Head Start expects, and they give us the funds to do. The parent that you saw in the video, I'm very sure was supported by Head Start to assist with paying for dental bills that were not covered by their insurance to get that follow-through done. And that is one of the unique parts about Head Start is they're federally funded, so they get funding to do that, which I see lots of heads nodding. And one of the questions was about challenges. Watching the first, participating in the initial committee time was such a huge issue for people. But once they got to the table, they saw that that investment in time was very important. And so having consistent people buy in from community partners is really helpful. And then towards the end of my time at West Central Minnesota Communities Action, we got Otter Tail and Wadena counties that incorporated the Initiative Foundation, not West Central Initiative Foundation. So I was able to work on that for a year before I left that position. So,
Very good. Thank you. So I just have a couple of questions that and I think you guys really covered most of what we had already talked about doing here, but if I was going to ask you, what's your number one benefit that you have seen for your organization with your involvement with the Early Childhood Dental Network?
I always cheat. I can't say there was one. I think the lasting legacy will be these 20 new hygienists and dental technicians that hopefully will stay in our region and be both role models and earn a living wage and be ambassadors for oral hygiene to communities that they have come from. So that's what really makes me smile. I forgot earlier, in fact, I made two terrible faux pas. I credited Lou Herr and Otto Bremer. It's Delta Dental that funded the diversity in dental workforce. And I did bring our magazine. The current issue has an article on that project, and there's a pile of them here if anybody wants to read more about it. Sorry, once I get going, it's hard to shut up. 2 Friday nights ago, I got a call, kind of late in the evening, and I thought I was getting pranked. And the woman said she worked for the president of Google. And she represented a program called STEM 2020, and they're looking at programs that advance women and underserved populations in STEM careers. And I said, well, how'd you find me? And she said, well, there's this company called Google. And she basically talked us into applying for an award for supporting this kind of work. So I think there's increasing appetite for this sort of initiative, recognizing that our state's demographics are changing really rapidly, and we need to invest in the workforce to make sure that we're meeting their needs. The other reality is serving kids in poverty. I had a very blunt, curmudgeonly predecessor at the foundation when I first arrived, and he loved to just say provocative things. And one day he came up to me and said, you know what? These days you can't be prejudiced against anybody anymore, except if they have bad teeth. If they have bad teeth, it is presumed they come from poverty and probably aren't very bright. And his point, no matter how offensively conveyed, was that if you have not been neglected in your dental care as a child, you're going to experience prejudice the rest of your life. And he actually had deep passion for this issue. So 20 years ago, we actually sponsored mobile dental clinics because he felt it would follow kids through life. And so if we can, even when it's a Band-Aid, even if I only got 200 kids this month, their lives should be different if we identified serious problems or got them on the right track. So this really is vital, critical work.
Well, I don't have anything that profound to say. Some of the number one benefits for us have just been the raising awareness about this issue. I can't tell you how many people I've had conversations with about oral health being the number one most chronic yet preventable disease in young children. People don't know that. Parents don't know that they need to get their kids to the dentist as soon as they have that first tooth, even before all of those things. One of the other number one benefits for us has been the collaboration that's happened across all the community partners. We're used to doing this kind of work at the Initiative Foundations. We collaborate with people all the time, and not everybody does that. So I think one of the biggest benefits has been bringing all these partners to the table and being able to use the money that we have in the best ways that we can, in the most efficient and effective ways that we can, and getting those community partners that don't always work together to actually work together to help address this issue. Most recently, having meetings with the Mayo Clinic and getting them on board has been huge in our area, because they pretty much are healthcare in our area of the state. So things like that, just seeing those small victories with the small amount of funds that we have, really, and those partnerships that are formed and don't go away. Those are the biggest benefits.
I think outside of the access, you can, I hate to use a cliche, but you can't always lead a horse to water. Even though there is oral health care available now, not all families are convinced that it's a good idea. And having the educational tools to work with families, especially for people in the early education arena that were interested in talking to families about oral health, it was a little uncomfortable because they didn't feel they had the knowledge of what to say. And so the materials that were developed were very family friendly, they're very usable, they're very accessible, they're available on the website. They're used, Jane can probably tell you how many people have even viewed them. They were very helpful in anybody in the community that was working with families to be able to use them, along with having a place to refer the families to get care.
So I just have one last question, and then I'm going to turn it over to all of you. If you have questions for us, we'd be happy to answer those. But what advice do you have for agencies or individuals that want to form partnerships to address oral health needs? And not necessarily just specific to early childhood, but to oral health in general. What's your number one piece of advice for them?
I'm going to start with the reminder that I work in largely rural areas. And so the usual suspects are already usually pretty well known, but the point is, if you only have those who already self-identify as early childhood experts or dental advocates, it's not a big enough pool. Jane and I were meeting, was it this week, or earlier this week, and I said to her, have you ever met a dentist who's not in a service club? Is there any service club that doesn't identify that children are a priority? We should have every service club sustaining this work. And if the money were there, even in modest amounts, I'm not important anymore. It's the folks in the field doing the work. The other two things I wanted to call out that I failed to share earlier, and I can think of three women that deserve credit for this, but Christine, you're in the room, so I'm going to claim it was exclusively your idea. We had glorious images of getting every kid exhaustive dental services early on, and just found that was pretty challenging to accomplish. And I'll claim it was Christine who said, why don't we also at least incorporate varnishing into this as a very low cost and multiple people can do it. Head Start staff can be trained to do it, and we could reach many, many more kids for just a fraction of the cost. And obviously, anytime you can go for an inexpensive solution that's lower tech, you can have more sustained impact and reach more kids.
My piece of advice would be to collaborate with others who are doing this work. We all have a limited amount of resources and dollars. We need to all work together to make the best use of those dollars and resources. Don't reinvent the wheel, share resources. We do that all the time across the state. One of the things that my dental network coordinators wanted to tackle this past summer was getting the word out, really a social media campaign around baby bottle tooth decay. And we needed a message that was very simple, no words, someone with speaking any language could understand. So we ended up deciding to tackle that in our region and hired a designer who came up with a very, very simple graphic. I wish I would have brought it along today, but I didn't. Of a bottle plus a crib equals rotting teeth. And we did the whole gamut of printing postcards with just 5 or 6 quick bullets on the backside to the Facebook campaign with a GIF. I'm becoming very social media oriented these days. And basically it was those 3 pictures, one at a time, and the teeth were even falling out. And funny story, my coordinators wanted an actual picture of real teeth that were very gross. And our communications person said we couldn't do that. She said, this is as gross as it can get. we can't make it too terrible for publicity purposes. But anyway, that actually ended up getting spread across the entire state with the help of Jane and the other partners here. We printed thousands and thousands of those postcards, got it translated into Spanish, and that Facebook post ended up being our, to date, #1 shared piece. And so we really can spread the word about some of these issues in a very cost-effective way if we all work together to do it, and not being afraid to share across agencies, to use others' resources. So that would be my bit of advice.
There's not a whole lot more to say than that, other than one thing, everyone in this room is really passionate about oral health. When you're going to an existing group to try to work within them, because you know they may have the same interest, remember they may not all be as passionate as you. Sometimes you need to back off. And also, Deb Hengel was also in that video. One of the things she always ended a meeting with was, who else do we need at the table to help us with this? And it really brought some great ideas about who we needed I mean, we even had law enforcement coming to some of our dental meetings because they were getting child abuse and neglect reports. So it's, you have to, the old think outside the box thing. And I also like the comment this morning about the work plan, the ever-changing work plan. Go back to it, because sometimes you can get too many ideas going at one time. So try to keep your focus going to make the biggest impact.
So with that, obviously I hope you've learned a little bit about who we are today with the Early Childhood Dental Network, and I'd like to open it up to all of you for any questions that you have about community organizing or efforts that you have questions on in your own respective areas. So, yes. Okay, so Heidi's question was, how are we addressing adult education so that we don't have multi-generational challenges with oral health? So I'm going to turn that over.
I'm not going to really give you the answer you want, because our focus is by definition early childhood. Obviously, though, the kids 0 to 5 aren't seeing the materials, it's the parents. Another of our lessons learned that I should have confessed to earlier was we had originally. That's you.
It's me.
I know it. I think the battery just died.
Here, why don't you come up here?
We'd originally, if I talk like a biologist, it's because I was one. We'd originally hoped to focus on age class birth to 1 in a first year of the program, follow it 1 to 2 the next year, but pick up the babies too, and then 2 to 3. So by the end of 3 years, we'd have every kid below the age of 3. Parents weren't willing to bring in kids that young, particularly if they didn't have teeth. So we kind of tore up that work plan and said, any mother with a kid 5 or under, come on in. And by opening it to the 5-year-olds, they brought all their kids, and we'd grab them while they were there. And when parents learned that we would treat any kid that came in, word spread more quickly throughout the community. Because again, it is parent to parent that's probably the most effective social network. Echoing Teri, we liberally steal everybody else's material and slap our own logo on it. I think we are up to 6 languages now. But again, at the end of the day, who do you trust? Is it even social media, or is it your neighbor who says, that's a good deal, you should go check it out?
Any other questions out there?
I'd like to add to that about, also about their, we started out with just addressing the access and education issue, but also started a focus on pregnant moms, which was so important and not everybody always thinks about.
Well, with no further ado, let's give a round here applause to our panelists, and thank you again for